Hello, hello, hello. Good morning. This is going to be uh, DH304, uh, Dental Health Education, video number 2 for week 2. We're going to be talking about uh, oral health education, oral health promotion, um, health literacy, and we're also going to be reviewing the topics of these health behavior models and health behavior theories and approaches, as well as reviewing the quiz for week 2. Okay, so let's begin here. Um, she starts out with the quote that Maya Angelou says about how people remember more uh, how they feel around others than what others have done, right? So one thing we need to get is that there's something called Maslow's motivational theory. It's basically a pyramid with at the top, you have what's going to be self-actualization needs, all the way down to physiological needs. So of course, you need the basics, right? You need water, air, and sleep. That's at the bottom of the pyramid. Then it starts going up to safety. Once you have the safety, let's say you have money, you have fire extinguisher, you have a home. Then once you get that, then you need your social needs. You need to have, maybe love, a baby, a dog. And then after that, you have esteem needs, which are like achievements and competence and stuff like that. And then the top one, which I mentioned in the beginning, is self-actualization needs, which is fulfillment, growth, and unity of understanding. So that's very interesting, actually. It makes a lot of sense looking at it and speaking about it. Which stage are you in? um, anyways, so how is oral health measured? Okay, so there's a relationship between oral health related quality of life and then oral health relationship. So the things centered around oral health quality of life are if you have a functioning masticatory and speech system, you're not, or you are experiencing pain, if there's psychological aspects as far as like how you look and how you sound, and then also the social aspects of like communication and intimacy and social interactions. So all that is centered around oral health related quality of life factors. But then there's oral health literacy, which is one thing that we're going to emphasize. Oral health literacy is centered around culture and society, the educational system, oral health outcomes and costs, and the health system in general. Um, One thing we don't want to forget is what is the definition again of oral health? That is, oral health is multifaceted and includes the ability to speak, smile, smell, taste, touch, chew, swallow, and convey a range of emotions through facial expressions with confidence and without pain and discomfort and disease of craniofacial complexes. So, um, oral health literacy apparently is evolving from um, just understanding to actually acting on it. So it is the degree to which individuals have the capacity to obtain, process, and understand basic health information and services needed to make health decisions, oral health decisions. And that is defined by the National Institute of Dental and Cranial Facial Research. Um, So, oral health literacy is effective at preventing diseases, increasing treatment, lowering barriers to access, eliminating inequities, and increasing care diagnosis and effectiveness. Um, Something that's very interesting, only 12% of adults have proficient health literacy. That's about 9 out of 10 adults that may lack the skills needed to manage health and prevent diseases. Um, One thing here to understand is that literacy is the single best predictor of a person's health status, correlating more closely than age, income, employment status, education level, and racial or ethnic groups. I can totally see that happening. Some people that I know. But one thing also we need to understand is the difference between oral health education and oral health promotion. Oral health education is the process of teaching people about oral health to help them prevent oral diseases. Oral health promotion is more than oral health education, but a wider scope into empowerment, confidence, role of behaviors, and towards a wider range of social and environmental interventions. So the World Health Organization says that the process of enabling people to increase control over to improve their health, whatever the hell that means. In a nutshell, we are oral health coaches that will empower while adding a wide range of social, behavioral, environmental interventions rather than a narrow focus on education into equation to improve oral health quality of life. Okay. So here we're going to go back to these conceptual frameworks and models on how to promote oral health. Okay. Um, these theories that help analyze and interpret health problems and develop and apply and evaluate interventions based on the analysis. So these are interrelated concepts. Somebody named Glanz defines them as interrelated concepts, definition and proposition that present a systematic view of events, situations by specifying relations among variables to explain and predict events or situations. So again, what are the core elements of oral health? That is going to be physiological function, disease and condition status, and psychosocial functions. And things that affect this are driving determinants, moderating factors, and also overall health and well-being. So those are an example of a framework for oral health. So again, it's about changing behavior. Some things that we need to consider, behavioral considerations for oral health, and things that are centered around that are oral health promotions, like brushing, flossing, and visiting the dentist. There's lifestyle-related behaviors like nutrition, smoking, alcohol. And then there's health-related concerns like general health, mental health, medication. Some of these things, an example of oral health promotion would be like affective factors such as values, dental phobia. Lifestyle-related factors are like past behaviors and skills. And any cognitive factors are like health beliefs and knowledge. Okay, again, health literacy is the biggest factor for health behavior change and improved health outcomes. So we're trying to increase people's health knowledge and beliefs and practices and capacity and self-efficacy and empowerment, so that they understand the motivation behind everything and the rules and the regulations and where these services are provided. And all this all stems down to the determinants of health, because that kind of dictates what are the risk factors or risk conditions to certain individuals. And that kind of stems into health education and health public policies. So we're just kind of got into the reasons of why and what. And so now we're going to kind of review what we talked about before. All these different models of theories of how to change behavior focus around what's called an ecological approach. So it's on the idea that health behaviors and health are both shaped by social environments and various levels of influence. And these are, as we've heard before, intrapersonal factors, interpersonal factors, institutional factors, community factors, and then public policy. So again, this should be kind of like a review. Intrapersonal factors are individual characteristics that influence behavior, such as knowledge, attitudes, beliefs, and personality traits. Interpersonal factors are the processes and primary groups, including family, friends, peers, that provide social identity and support and role definition. Then we have institutional factors, which are like social institutions and organizations characteristics, and formal and informal rules and regulations for operations. Um, these can also be policies and informal structures that may constrain or promote recommended behaviors. Then we have community factors, which are social networks and norms or standards that exist formally or informally among individuals, groups, or organizations. And then there's public policy, which is local, state, and federal policies that regulate and support healthy actions. So in the past, we've touched upon intrapersonal theories, interpersonal theories, and community theories. And that's kind of what we're going to review again right now. So for useful theories for an individual, right, would be like a health belief model, stages of change theory, or like TPB, theory of planned behavior, which we're not talking about in this class. For interpersonal, amongst others, is the social cognitive theory. And then for community theories are things such as the social ecological model, community organization, or diffusion of innovation. So intrapersonal level theories are a trans-theoretical model or stages of change. And also intrapersonal is also the health belief model. So an example of the trans-theoretical model, which is the stages of change, that's going to be pre-contemplation, contemplation, decision, action, and maintenance. So just to kind of get into this further, pre-contemplation is being unaware of a problem, but not having a thought about change, and then increasing the awareness for that. Contemplation is actually thinking about the change and then getting motivated to encourage the making of specific plans. Decision is making a plan to change, assisting in developing concrete action plans. Action is implementing specific action plans that assist with feedback and problem solving. And then maintenance is continuing the desirable action and assisting with coping and using reminders and finding alternatives and avoiding relapses. So if a patient says, I'm not interested in talking about stopping to smoke, that is pre-contemplation. If the patient continues to says, every now and then I think about stop smoking, that's contemplation. If the patient says, I also talked with my husband and I told him I would stop January 1st, that is preparation. Then we have, I stopped smoking 3 weeks and 2 days ago, but I had a few cigarettes at a party on Saturday. That's action. And then I stopped smoking about 2 years ago and have not smoked since. That is maintenance. Good job, lady. And so again, if we go down this model, we're progressing. If we go back up, we're relapsing. The health belief model describes as a way to explain people's use perceptions. They themselves are susceptible to diseases. The disease or the condition is serious. Interventions recommended will prevent diseases. So these are perceived susceptibilities, which is one's own opinion of the chances of getting the condition. And it can put people at risk if it's too low. The perceived severity, one's opinion of how serious a condition is, specifies consequences and risks of conditions. And then there's perceived benefits, one's own opinion of the efficacy of the advised action to reduce it. Then there's perceived barriers, which is one's opinion of the tangible and psychological costs, advice to action. Then there's cues to action, strategies to activate readiness, and self-efficacy is confidence in one's ability to maintain and take action. Here's an example. Does your father think he is at risk for oral cancer because he smokes? That is susceptibility. Does he think oral cancer is serious enough? That is severity. Limiting his use of smoking will reduce his risk for oral cancer. Those are benefits. Is he confident that he can stop smoking? That is a barrier. How confident is he that he will overcome temptation? That's self-efficacy. All right, it's strictly information based, does not factor in the client's attitude, beliefs, or motivations, um, their habitual behaviors, or their determinants of health, social determinants, environment, and economical factors and economical influences on the health behavior. So that is the downside to the health belief model, that it doesn't factor in the client's attitude, beliefs, motivation, or habitual behaviors. So let's go into the quiz here. So the first question is, your sister is thrilled to tell you that she's expecting a child. She asked if you would be interested in speaking about oral health concerns at her hospital group. You agree, start to develop presentation, increase their knowledge is your goal, and how to care for babies. So your sister tells you that members of her group are feeling tremendous responsibility for their unborn child, and that several members of have expressed interest in having a healthier lifestyle because they had now more than themselves to think about. This represents a concept in which of the following health promotion theories that can be applied. So this is going to be health belief model, because that right there, the moment we read that members are feeling tremendous responsibility for their unborn child, and several have expressed interest in having healthier lifestyles, that is health belief model. Okay, as we talked about before, because that's perceived susceptibility, perceived behavior, um, and then also the benefits, perceived benefits. Okay, next question. As you develop your presentation, you're using the health communications process, which of the following should you do first? Well, the answer to that is review background information to learn more about oral health of this population. Perfect. So remember, data is very important. You should never act just because you think. You should always have data backing up um, your reasons here. So the wrong answers were: assess the effectiveness of the presentation as you proceed to make refinements. That's obviously wrong. Set objectives and develop a plan to make the presentation, and develop and evaluate pre-test message concepts. Yeah, all that sounds wrong. Then we have interpersonal level, which is social learning theory, SLT, and motivational interviewing. The social learning theory is also called the social cognitive theory. So that's social learning theory, SLT, and social cognitive theory, SCT. Um, 4 ways people learn for the social learning theory is observing others, remembering and imitating the observed behavior, modeling, and inference is made from the evidence of observed outcomes. As a result, the client's environment has a bidirectional influence known as reciprocal determinism, and then self-efficacy is important concept. Um, so like for the children, their behavior, they model other people, and then they have environmental factors. So again, that's reciprocal determination, behavioral capability, expectations, self-efficacy, observational learning, and reinforcement. Motivational interviewing is a little bit different. Must be client-centered, must be empathetic, create a discrepancy in the client's mind, role with resistance, and then self-efficacy. These are open, affirmative, reflection, and summary, tools and techniques. So you have to ask open-ended questions, be affirmative, do not judge, and have reflection by demonstrating understanding of the client, and then summary of what was discussed. Then there's the community level theory organizations, community theory organization, diffusion of innovation and organization change. Diffusion of innovation. This is relative advantage, compatibility, complexity, triability, and observability. And then we're going to skip all that stuff because we're going to go into these questions now. So first question, your first task is to review various health promotion theories and determine which would be useful for this project. You decide that you need to assess whether the women in the target population perceive that their children are consuming foods high in sugars. If so, whether the mother perceives that it puts them at risk for dental caries, so when you see the word perceive, you want to think about health belief model. So that's C. There's another question. Your next task is to select and tailor health messages you want to include in your health communication approaches. Which one of the following approaches is an example of tailoring a message? The answer is design short learning modules geared to each level of caries risk identified during the assessment process. So tailor a health message to include the communication and approaches. So you're not gonna use separate brochures for each ethnic group. No, you're not gonna develop learning modules that focus on women's roles as mothers, and you're not gonna use a short booklet that leaves a blank place in which to write the child's name. What you are going to do is design short learning modules geared at each level of caries risk identified during the assessment process. So tailoring and assessment process are the key words there. All of the following except one are useful strategies to help with target population learn information. The answer is have them read rather than hear and see the information. They will learn more from reading it. So that is not a useful strategy. Okay, that was what the question was basically asking. Because everything else sounds like a better strategy, really. If you ask them to demonstrate a skill to help reinforce, then you ask them to repeat instructions in their own words, and then using a hands on interactive multimedia approach. All that is great, except for having them read rather than hear. People usually don't like reading stuff. I see why. Question case study. Another one, you decide that the project materials need to be available in at least English and Spanish. Which of the following approaches is least likely to result in effective and culturally relevant materials? So the answer is do a literal transition from English version to Spanish. So that's the correct answer because it is least likely to be effective and culturally relevant because it's already in English. Okay. All the other answers are wrong because we're not going to use translators who are bilingual and bicultural. Test the materials in 3 focus groups, no, or create the materials in dual language format. No, we're going to do the least likely. Those are all good. But the worst one is do a literal transition from English version to Spanish. Another question during the project, you have an opportunity to present information on the project as a statewide public health association. You are the most interested in discussing and getting feedback on ways to improve materials. Which presentation format would you allow the best opportunity to accomplish this, to get feedback? That's going to be a roundtable discussion because there is an objective there. Another one here is you're a dental hygienist in a school-based health center. You are part of the staff, sports medicine and all that, in addition to having clinical students are required to take health class for 4 weeks in 9th grade. Parents and teachers have reported increase of smokeless tobacco, cigarettes, and e-cigarettes by students outside of school rounds. The principal has asked the healthcare center to address the problem. So the first team meeting is going to be discussion about conducting more comprehensive needs assessment. All the following activities except one are appropriate for the needs assessment process. The answer is discuss what approaches can be used in the health center to encourage teens to quit using tobacco. That's wrong because you can't do an approach without doing a needs assessment first. We have to identify what's going on first. So Everything else is correct as far as being the wrong answer because we were looking for the exception. The exception as far as an appropriate or needs assessment process. So all the following activities, except one, are appropriate for the needs assessment process. So the one that's wrong is discuss approaches and can be used in health center to encourage teens to quit. Perfect. Which of the following approaches is best one to use for testing key communication messages that will be used with teens? It's conduct separate focus groups for teens who, one, chew tobacco, two, smoke cigarettes, and three, use e-cigarettes. What would be the most effective communication pathway to reach teens? That would be social media messages. Um, the health team is considering incorporating assessment of teens' knowledge of health effects of tobacco and their current use of tobacco products into their health history that they made complete for a dental appointment at the health center. Which combination of the following health promotion theories will be the best to design intervention based? It's going to be the stages of change theory and health belief model. When designing assessment and evaluation methods and measures for this initiative, what information might be least important to document? Specific brands of smokeless tobacco and e-cigarettes used. We would not ask them that. Last question for this is, which of the following strategies would be least effective choice to ensure sustainability of the program? It's use a standardized tobacco use education program from a reliable professional governmental website to ensure validity of information education strategies. That would be the least effective choice. Because people are more modernized now. People do blogs, there's counseling, graduate programs, and there's like you can add health unit class to 10th, 11th, 12th grade to reinforce learning and continually promote. Those are all better than using standardized tobacco education programs. Great. Last thing here, we're going to go over quiz 2. So a blank is a set of interrelated concepts, definitions, and propositions that present a systematic view of events or situations by specifying relations among variables to explain and predict the events or situations. The correct answer is theory, because theories analyze and interpret health problems. Okay. Number 2, viewing oral health problems primarily as the patient's problem and proceeding to educate the patient about how to improve oral health is doomed to failure, because it skips directly to a generic intervention and does not assess the patient's point of view. Both statements and reason are correct and related. Yes. Dental hygienists often assume oral health problems are due to a person's laziness or unwillingness to follow simple oral care promotion recommendations. Lecturing the person about the facts to improve oral health is a doomed approach because it's a generic intervention, does not assess or validate the person's point of view or health beliefs, and does not consider the environment, literacy, or cultural circumstance. Each of the following is an example of the community level influence of health promotion theories, except one. Which one is the exception? Intrapersonal. That is the exception to community level. Yes, institutional and community factors and public policy provide an ecological approach to health promotion that focuses on both population level and individual level. Blah, blah, blah. Okay, great. Ouch. Intrapersonal. Okay, so that was it. Okay, number 4, institutional and community factors and public policy provide an ecological approach to health promotion that focuses on both population level and individual level determinants of health. According to this approach, multiple interventions are often needed that are community-based, not just individually focused to effectively initiate and sustain behavior change. Correct answer, neither long-term retention of knowledge nor behavior change. I don't even know what the fuck that question was asking. Okay, next. Years of research have shown that a one-time educational intervention without a follow-up is totally ineffective for long-term retention of knowledge or behavior change. Which of the following perceptions must be adopted first according to the health belief model? The correct answer is the individual is susceptible to the disease or condition, because the health belief model um, perceptions are necessary to motivate an individual. Number six, pointing out strengths using persuasion and encouragement and approaching behavioral changes in small steps are all part of which of the following concepts of the social learning theory? Pointing out strengths and using persuasion and encouragement and approaching behavioral changes in small steps are part of which of the following concepts of the social learning theory? That's going to be self efficacy, because self efficacy is confidence in the ability to take action and persist in action. Number seven, the various components of different health promotion theories can be brought together to address a specific health issue. The strengths and limitations of the diverse theories can be balanced when they are used in combination. Both statements are true. Health promotion theories are often combined with an intervention. In addition, multiple theories are combined to enhance ecological dimension. Number eight, interactive multimedia formats are usually blank effective for retaining knowledge than reading or listening to a message. And multiple strategies have blank effect on improved health literacy. So more. Interactive multimedia formats are usually more effective, and multiple strategies have more effect. The World Health Organization defines health promotion as the process of enabling people to increase control over and to improve their health. True. The Ottawa Charter identifies three basic health promotion strategies: advocacy for health, enabling people to achieve their full health potential, and which of the following? Reducing disparities in the healthcare system. Correct answer, mediating the different social interests in pursuit of health. I hate the way she fucking sent this to me. 11, behavior that leads to improved oral health can be affected at three levels: interpersonal, intrapersonal, and which of the following? Community. Okay. The social learning theory posits that people learn primarily in four ways: vicarious observational learning, remembering and imitating the observed behaviors of others, inferred knowledge from evidence and observed outcomes of behavior, and which of the following? Correct answer, judgments voiced by others. According to the social learning theory, one of the ways that people learn is through judgments voiced by others, such as testimony and promotion by experts. Number 13, the following scenario is an example of which theory of health promotion? A church pastor noticed that elders of the communities have stopped coming to church suppers because they were mostly edentulous and appeared to be embarrassed. This pastor called the dental school for help. This is going to be community organization theory. All right. Number 14, the most effective way to reach individuals to increase their knowledge or to change their behaviors, which are the following: tailor the messages. These message strategies are intended to reach a specific person based on their features unique to that person. Okay. Number 15, which of the following presentation formats is most likely to have limited audience interaction? That is going to be an oral paper. Benefits of oral paper format are that a large group can be reached and the presenter can speak from printed notes or directly from slide notes on a computer. Limitations are that room lighting is sometimes fairly dark, interaction with the audience is limited, and there's a wide variability of knowledge. The concept of pre-contemplation presents the first stage of the stages of change theory. Pre-contemplation stages of change, that's true. Empowerment is a key. Yes, pre-contemplation stages of change, which is trans-theoretical. There we go. Empowerment is a key facet of community organization. True, empowerment is a key facet of organization. Grassroots theory, empowerment, great. Okay, which concept of diffusion of innovation theory helps us tailor innovation to the intended audiences, values, norms, or situations? Is compatibility. Compatibility helps us tailor innovation to intended audiences. Which of the following which method is appropriate for determining prior to a launch whether the message are the appropriate language and literacy level culturally and acceptable to the intended audience. That's going to be a focus group. And the evaluation of communication formats, channels, and materials is vital to which of the following is ensuring program sustainability. So evaluation of the communication formats, channels, and materials is vital to ensuring program sustainability. Perfect. All right. So what a boring class. And we're done. Thank you.